Hello, everyone. Welcome to Pharmacology. I hope you are ready for a wonderful semester to learn all about the nurse's role and responsibility when it comes to pharmacology. Also, the responsibility with administering medications to your patients and then caring for your patients by working through the whole nursing process. Oh no, not the nursing process. This semester, you will learn a lot about the nursing process. You will use the nursing process in pharmacology to assess your patients in relations to the medications they are already taking, and then assessing them in regards to the medications you are administering. It is your responsibility to make sure your patients are being treated adequately and safely. Remember, we are trying to get our patients toward wellness, and medication administration definitely goes along with this. This course is going to be teaching you about the different medications that you will be giving to your patients. I will break the medications down according to the body systems and into the different drug classes used for each body system. Some examples of what we will discuss in this class are neurological medications, respiratory medications, and cardiac medications. When we learn the different classes of medications, I will go over the main medications that are given for the different disorders we will discuss. I do not expect you to memorize all of these medications since healthcare changes so rapidly. There are always new medications that are being approved and then prescribed by the doctors, so it will be virtually impossible for you to memorize all of the medications we will discuss. When you are practicing as a nurse, you will find that the more you administer specific medications for specific disorders to your patients, you will become more familiar with these medications, such as medications for hypertension. There are a lot of patients with hypertension in our society, and they do take medications for this disorder. A lot of the information will be discussed again in your fundamentals class from this PowerPoint, so don't get too overwhelmed. See you all soon in class.
What exactly is pharmacology? Well, pharmacology is the study of the drugs and also the interaction of these drugs with living systems. So when you are the nurse and you are administering the medications, obviously you are administering them to a living person, your patient. Right now, there are well over 10,000 medications that are currently available. We're going to talk about prescription medications, and then there's also over-the-counter medications where the patients can go to the pharmacy themselves and buy the drugs without having a prescription. When it comes to nursing, it doesn't matter which unit you're going to be working in, what nursing specialty you go into. Pharmacology really is the core of patient care. When it comes to learning pharmacology, I want you to remember this is a gradual, continuous process. The more experience you get with your patients, the more experience you get with administering medications, you are going to be continuously learning. That's why it's so important to have your drug guide. Make sure you have your nursing central because that really is your resource and you're going to use that a lot as a nurse. You never ever want to give a medication to your patient unless you understand that medication. You need to understand the drug action. You need to understand exactly how it's working within your patient's body. And then you got to make sure you're looking for any adverse effects that your patient may possibly have with these medications. And we're definitely going to learn more about this over the semester. So what exactly are drugs used for in healthcare? I want you to make sure you understand that these drugs are chemicals, they are substances, and the reason why we give these medications to our patients, we're really trying to provide the patients with maximum benefit, and we really are trying to make sure that minimum harm will be caused to our patients. Remember, we're always trying to get our patients towards wellness, And we really need to think about patient safety. So think back to your fundamentals class. And remember, we are trying to keep our patients as safe as possible. In fundamentals, we talked a little bit about the history of nursing. And remember, way back in the olden days, we really didn't have nurses. The doctors were the ones that would go to the patients' houses, and they would provide them with different types of medications. I did post on Blackboard some history of medications, and I think you'll find it a little interesting when it comes to the different drugs that we used to use as medications. They are now illegal drugs that should not be used. But we think about the history, and we got to think about the evolution of nursing when it comes to the responsibilities regarding drugs. It used to be that the doctors were really more hands-on with their patients, and they were the ones administering the medications. They were the ones looking for those side effects and actually looking for the benefits also to see whether or not the medication was working as it intends to work. Nursing now has a much larger responsibility regarding the medications that we administer. It really is a balance between nurses, physicians, and pharmacists. Remember, we need to have a doctor's order in order to administer medications to our patients. Once we get that doctor's order, it goes to the pharmacy in the hospital setting, and the pharmacist will double check, make sure that it's not too large of a dose, make sure that the patient doesn't have drug allergies and can't take that medication. And they're really doing a check also to make sure it is safe to give to the patient. And then the medications come up from the pharmacy. Most of the time we have a Pyxis machine, remember back to fundamentals. And now it's the nurse's responsibility to go draw up the medications, make sure that you're getting the right medication, the right dose of the medication, make sure it's not expired. And remember, you have to do at least 3 checks with the MAR and then with the medication that you're pulling. So you're going to participate in this system of checks and balances. And remember, we're really just trying to make sure we are not making any mistakes because we want to minimize harm. Now, when it comes to administering medications to your patient, the nurse is legally liable. So think about that. You as the nurse, you have a big responsibility when you are administering medications. Once you give that drug to your patient, you are now liable. You are responsible to make sure that you have given the correct drug, the right dose, you gave it the right route. Why? Because the nurse can be prosecuted. Yes, I'm talking about the legal system and going through the courts. The nurse can be prosecuted if you give the wrong drug to the wrong patient, or if you give the wrong dose or the wrong route, the wrong time, or if you do not document adequately. So make sure that when you're administering medications, as a nursing student, you want to make sure your nursing instructor is right there. You want to make sure that your co-assigned nurse is right there, and you're really going through all these checks and practicing administering these medications to your patients. With the more experience you get, the better you're going to get at administering medications. But make sure you're also doing those 2 patient identifiers. You're asking the patient their name and date of birth before you give any medications to them, and check with their wristband and make sure you have the right patient. Again, now we're thinking back to fundamentals. So what exactly is the nursing responsibility? What is your responsibility when it comes to administering medications? Remember back to those 6 rights? Well, make sure you're giving the right drug to the right patient. You're giving the right dose. A lot of these different medications we're going to talk about, they can be administered PO, they can be administered IV, they can be administered sometimes IM. So you want to make sure you're giving it correct according to the way the doctor ordered it. And then, of course, it could be a different dose depending on what route you are giving. Remember, IV gets directly into the vein, so they're going to have that medication immediately. It doesn't have to go through the liver and be spread out through the bloodstream from the liver. And we're going to talk all about this once we start talking more in our future classes. But you also want to make sure that you're giving the medication at the right time, and then always document adequately. And you cannot document ahead of time prior to administering the medication, and make sure you're not waiting till the end of your shift to document. And of course, a lot of hospitals nowadays, they have a handheld. It's almost like the cash register at the grocery store, where you go into your patient's room and you have this handheld device, and you're actually going to scan the patient's ID bracelet, so it's going to document automatically for you. It's a really nice thing, that technology that we have advanced when it comes to administering medications. Again, as the nurse, you have a huge responsibility when it comes to administering medications. So make sure as the nurse you know these certain things. So put a highlight next to these. You need to know what medications are appropriate for your patient. Remember, you're taking care of your individual patients. You need to know what drugs are contraindicated for your individual patient. And then you need to think about possible consequences. So you need to then think about the interaction between the drug and the patient. So then you got to think about, okay, does my patient have a condition that warrants the need for this medication? You know, maybe the doctor ordered an antihypertensive drug and your patient doesn't even have high blood pressure. Well, think about the detrimental effects that would happen if you would go ahead and administer that medication. Well, if they don't have high blood pressure, now all of a sudden you're bottoming out their blood pressure. Not a good thing. So make sure that you know these certain things. Make sure you understand what your patient's drug list is already, so you know what your patient's medications at home are. So every patient, when you do your assessment part of the nursing process, you are asking your patients, what drugs do you normally take? Is this a new drug for you? And then, of course, education goes into play in the nursing responsibility. If they don't understand what the medication is, you now should be teaching them about the medication. And don't ever lie to them and say, well, I don't know, or, oh, I think it's for this. If you don't know, it's okay. Say, I don't know, but I will find out for you. And then make sure you go find out the correct information and then bring it back to your patient and notify them. So you're connecting all those dots so they have a full understanding as far as what's going on with them. Again, we're thinking back to what you learned in fundamentals. So remember, you are supposed to be an advocate for all your patients. So make sure you're paying attention to what's happening with your patient. Make sure you're giving individual care. Don't be mixing up your patients and getting confused with which patient has which condition. Make sure you're following your patient's status very closely. So remember, you have to go in and do your head-to-toe assessment, and then make sure that you're going in and doing that focused assessment as needed to make sure your patient is getting towards wellness. That's your responsibility to help them that way. You're also responsible for detecting those mistakes, like I said, and it doesn't matter if it's the pharmacist who made the mistake or that doctor making that mistake. It's your responsibility to notify them and correct that mistake. So if you pick up on a mistake, you need to pick up the phone, you need to call the doctor and tell them, you know, I think there's a mistake here, and discuss it with them. So then you're going to use your SBAR communication. You're going to talk to the doctor about situation, background of the patient, assessment of the patient, and then what recommendations you would give. So we're communicating effectively with the prescribers. Remember, the nurse is going to be the first member of the healthcare team to observe if there's any problems, and you're going to be evaluating the responses to those drugs. And then it's your responsibility to intervene if required. So if you see a problem, you need to take those next steps to correct it. So therefore, you as a nurse, you need to know the response that the medication should be eliciting. So you need to understand, why is my patient getting this medication, and what exactly is it going to do for my patient? More nursing responsibility, and this comes down to patient care. So prior to even administering medications to your patient, think about assessment. We need to do pre-administration assessment. Okay, what's wrong with my patient here? Am I giving a blood pressure medication? I know I keep going back to that, but you're going to give lots of antihypertensives. So if you need to give an antihypertensive, what do you think you should do before you give that medication? Well, if you said, take my patient's blood pressure, your answer is correct. Prior to giving any medication that can elicit a response, you need to understand, okay, what is happening at this current time with my patient, get that baseline data, and then you can administer the medication such as the antihypertensive. And now you need to go back in and reassess, make sure the drug is effective. So now guess what? What do you have to do when you're reassessing? Well, if you answer, take my patient's blood pressure again, you are correct. So you give the medication, then you go back in. If it's a PO medication, typically an hour. If your patient's only ordered every 4-hour blood pressures, then it's okay. Go back after 4 hours, recheck your patient's blood pressure. So how do you know whether or not the medication is effective? Well, if the patient's blood pressure decreased, went back into normotensive range, or maintained in normotensive range, then guess what? The medication worked like it was supposed to. Other responsibility, you're responsible for the dosage, you're responsible for actually administering the medication. And then again, remember I said you need to evaluate, and then you need to promote therapeutic effects. So think about, there's other things besides medications that can help our patients. So we think about those nursing actions. If you have a patient with high blood pressure, do you want to go in there and cause stress for that patient? Well, no, we want to decrease their stress. So maybe they have a family member in there stressing them out. We want to make sure we do those nursing actions, those non-pharmacological measures, make sure we're promoting that calm environment, and we're really helping to keep their blood pressure normotensive. Another responsibility when it comes to administering medications, we need to try to minimize adverse effects, minimize those adverse interactions. So we don't want to be giving 2 drugs at the same time if they're going to interact with each other. Maybe we can just space them apart a little bit. And of course, that's when it comes to play where you have to understand, okay, what does this medication do? And then you're going to be making clinical judgments. Remember back to medication administration and fundamentals, when you learned all about doctor's orders and how these orders are going to be written for these medications. Well, think about, some of these medications are going to be PRN medications. Well, now it's up to you as a nurse to understand, okay, well, when exactly do I give my patient this medication? It's ordered PRN. Well, PRN, you're not going to give it around the clock. So now you have to make that decision whether or not it's time to administer that medication. That's making that clinical judgment. And then if by chance your patient does get toxic from taking a medication, now you need to know how to deal with it. So you're going to manage that toxicity. And of course, you're going to be calling the doctor and telling them, step by step. Okay, this is what's happening with my patient. You're going to use those good assessment skills and then those good communication skills, so you're making sure the doctor understands what's happening. And then you're probably going to be getting new orders in order to best manage that toxicity. We mentioned about pre-administration assessment. You as the nurse, you're going to be going in and you need to collect baseline data. Why? Well, you need to have that baseline data, like I said about the blood pressure. You need to have that so you can evaluate whether or not the medication is working effectively. It's giving that therapeutic response. And you're also going to be looking for adverse effects. And we got to think about our high-risk patients. And again, think back to your fundamentals class and different types of patients that we deal with. If we have a patient that has liver problems, kidney problems, they're going to be high risk. And we definitely will talk more about this when we talk about pharmacokinetics and pharmacodynamics. We got to think about their genetics, because that could put them high risk. If they have a drug allergy, we want to make sure we're not giving that medication to them. If they're pregnant, now there's another person that we have to think about. So it does put them high risk. Some medications are safe to be given throughout pregnancy, and some can be very harmful to the fetus and even kill the fetus or cause a miscarriage. So we really do need to pay close attention. We're going to learn about the different pregnancy drug classes and which medications are safe to give to pregnant females. Elderly patients are going to be high risk, as well as pediatric patients. So think about what you learned about the elderly patients. As they get older, their kidneys tend to not work as well. Their livers don't function at top capacity, so they are more at high risk. And then pediatric patients, some of them, they may not be fully developed yet, and it all can affect the dose, it can affect the route. So we just need to pay close attention to these patients. And then, of course, use your tools. Make sure that you're taking that patient history, ask those questions. Make sure you're doing your physical assessment. And also remember, you should be collecting your data like that detective, and make sure you're looking at those lab results, because that's going to give you a lot of information whether or not your patient may need a different medication, or it could be affecting how the medication interacts within the body. When it comes to the dosage of the medications and administering the medications, you need to remember that some of these medications have more than one indication or more than one reason why we will give that medication. And then, of course, the dosage may differ depending on which reason that we are giving the medication for. And again, like I already said, many of these medications, they can be administered by more than one route or even in a different form, and you're going to learn more about these different medications. And then the dosage may differ depending on the route selected, like I mentioned before. And just remember, certain IV medications can cause severe local injury if by chance that IV becomes dislodged. So before you ever give any IV medication, you need to check your IV site and make sure that that IV is intact and the site is without redness or edema. One example of a medication that can cause necrosis is Phenergan. Phenergan is an antiemetic drug. And back a few years ago, a notification came down that according to policy, we were no longer allowed to give Phenergan IV push. I have given a lot of doses of Phenergan IV push, and thankfully I never had this happen. But what's pictured there is somebody who had Phenergan IV push, and the IV was dislodged, and you can see it caused necrosis. That drug, it went on the outside of the IV site into the tissue, the surrounding tissue, So this IV then eviscerated, and it can cause severe local injury. So just be very careful when it comes to administering your IV medications. Phenergan can still be given IV, but it now needs to be diluted, and it's typically given as a piggyback instead of an IV push medication. As the nurse, you're going to be checking your medication orders. So you're going to be looking at the MAR, and you're going to also be looking at the physician's order for the medication. Make sure you're reading every medication order very carefully. Make sure you're verifying the identity of every patient that you're going to be administering the medication to. Make sure when you're pulling the medications from the Pyxis or the drug cart, you read the medication label very carefully. You're going to learn that some medications have very similar names, such as Toradol and Tramadol, two completely different drugs, but as you can hear in the sound, they're very similar. They're spelled very similar, and you want to make sure that you're not mixing the drugs up. In fundamentals, you learned a lot about dosage calculations, and here's where it becomes more important. You want to make sure you're verifying every drug, make sure that you're giving the correct dosage, so you're going to be doing your calculations. And of course, in your drug guide in Nursing Central, it will tell you what the normal dosage is, and of course it's going to be typically milligram per kilogram, depending on your patient's weight. So you want to make sure you verify those calculations. And then if you're giving any medication that needs special handling, make sure you're implementing those special handling, because it could cause harm to you, it could cause harm to other people, it could also alter the drug itself, so make sure you're handling it the way it's intended. And then don't administer any drug if by chance you don't understand why it is supposed to be given. Do not make that mistake. So make sure you have a full understanding. One thing I wanted to tell you also, if you go into a patient's room and they're asking you about the medication and you don't know the answers to the question, it is okay to pull out your drug guide, explain to them that you have the drug guide, maybe it's on your phone. Just explain to them, I don't know the answer, but I can certainly look it up right here. I have the drug guide right here on my phone, and just make sure you're showing them what exactly you are doing, so they don't think you're taking pictures of them. And yes, they will think that, and they may think you're recording them. So just explain what you're doing so everybody understands. I talked about administering medications. You're going to be going in and reassessing your patient. And why you're doing this is you're going to be evaluating to see if the medication is working as it's intended to work. So evaluating that therapeutic response. So it is one of the most important aspects of drug therapy and drug administration with your patients. I know I've said this many times, but make sure you understand the rationale for the treatment. Make sure you understand the nature and the time course of the intended response, because if you're expecting a response in an hour, you should be going back in an hour and seeing whether or not the drug was effective, or if they're having a side effect from the drug. So if you do not understand the intended use of the drug, you will not be able to effectively evaluate that drug. So it's very important to have a complete understanding of what each medication is used for, why your patient is getting the medication. In order to minimize adverse effects when it comes to drug administration, you should really always know those major adverse effects. And how do you know which ones are the major adverse effects? Well, remember in fundamentals, we talked about Nursing Central, the drug guide, and the life-threatening adverse effects are going to be in capitalized red letters. The italicized words are going to be the more common adverse effects. And then the ones that are just normal typing in your drug guide, those typically only a few people had those responses when they were going through the drug testing. Make sure you always know also the time when these reactions are likely to occur. So if they're going to have an adverse effect, is it going to be the first time they have the drug? Is it going to be after a few doses? Make sure you understand, when is this adverse reaction probably going to occur. And then, of course, you need to be evaluating your patient, because you're going to be looking for those early signs that an adverse reaction is developing. If you can pick up on those early signs, now we can stop administering the medication, maybe give an antidote in order to stop a really bad adverse reaction from occurring. And then make sure you're using interventions that can help your patient with minimizing discomfort and minimizing that harm. We're always trying to maintain patient safety. I mentioned this earlier about the clinical reasoning and making those PRN decisions. Remember, PRN means pro rata, and it means as needed. So as the nurse, it's up to your discretion as far as how much of the drug to give and when to give it. You may have a patient that's ordered, let's just say Percocet, for example, and it may be ordered Percocet PO every 4 to 6 hours, PRN for pain, 1 to 2 tablets. Well, goodness gracious, when do I know to give this medication? It's ordered PRN. Well, if your patient's having pain, how are you supposed to know whether or not you give 1 to 2 tablets? A lot of times what I do is I check to see what they took in the past. Did they take 2 tablets in the past, or have they only been taking 1? Are they taking it every 4 hours? Or are they taking it every 6 hours? Maybe they don't need it as often, so they're only taking it every 8 hours. Maybe their pain is pretty much under control. So you can look these things up. Who else could you possibly talk to? Well, your patient is probably going to be your best resource. So you can ask them. Ask them, do you want 1 tablet? Do you want 2 tablets? And of course, you're assessing the pain. So you're going to be asking questions such as, well, how bad is your pain on the pain scale, 1 to 10? And ask them the location of the pain. Ask them what type of pain that they are having. Ask them if anything else helps to relieve it. So this is helping you to make those clinical decisions. Remember, again, you need to know the reason for the drug use. And a lot of times nowadays, the doctors are writing right in the doctor's order, especially those PRN medications, they're writing why you would be giving this medication to the patient. So they'll order it for pain, or they'll order it for an increased temperature, or they'll order it according to blood pressure parameters. So make sure you're able to assess your patient's medication needs. Make sure you know what PRN medications are ordered, and make sure you're checking to see if they're having any of these ailments that you wouldn't have to call the doctor and bother the doctor. Maybe you already have an order. Maybe your patient's nauseous, so you can look at the PRN orders and see if you have an antiemetic. And then you can just give that antiemetic using that clinical reasoning. Here's some more examples. I already mentioned about the Percocet, and right there is the same exact example I already talked about. You may have Tylenol 650 milligrams PO every 4 hours PRN. So you also have Motrin there, 600 milligrams PO every 6 hours PRN. Right there you have 3 different medications that are given for pain. So depending on what type of pain your patient is having or what has caused the pain will help you make that clinical decision as far as which pain medicine to give. If your patient is the same day surgery or even 1 day post-op, they may be having more pain, so they require that narcotic, such as the Percocet. Maybe they're getting better, and we can switch them to the anti-inflammatory, the Motrin 600 milligrams. Tylenol typically doesn't work very well for pain. Motrin typically works better, especially if they've had surgery, because we've caused inflammation by making that incision. So typically Motrin will help better for that type of pain. Another thing to remember between Percocet and Tylenol, Percocet has Tylenol in it. So we want to make sure we're not overdosing our patients on Tylenol. So you need to make sure you're checking, okay, well, how much Percocet did they have? And you need to look up, well, how much Tylenol can I give? Because you can overdose your patient on Tylenol. Another example here is Senokot, 1 to 2 tablets, PO every 12 hours, PRN. Senokot is a stool softener, so maybe your patient is constipated, and this is common, especially if they've been in the hospital for a little while. You know, most people, they like to go to the bathroom at their house. They go through their same routine, so they may end up being constipated. Or, you know, if they had a surgical procedure, we got to think about, well, they're probably a little dehydrated, so we can increase the fluids, increase the water to help them go to the bathroom. Another example is diphenhydramine, that's Benadryl, and that's 1 to 2 tablets PO every 4 to 6 hours, PRN. Typically, we're giving Benadryl in the hospital if they're having an allergic reaction, or they may have some itching. There are some narcotics that can cause the patients to be itchy, so the doctor will order the Benadryl to help with that itching. So just make sure you're understanding what are these medications used for, because it's going to be your clinical judgment that determines whether or not you are giving your patient these PRN medications. Here we go again, talking about the nursing process. Well, what does it have to do with administering medications in drug therapy? Well, we already talked about prior to administering the medications, you're going to assess your patient. You should be doing a head-to-toe assessment, but you're also asking questions. You're going to be asking questions related to the medications that are ordered. And then you're going to be prioritizing your care. Okay, well, what time do I have to give these medications? You may be taking care of 5 patients, and you have 9 o'clock meds to give to all 5 of these patients. Well, how in the world can you be in 5 patient rooms all at one time? Well, most hospitals now give either a half an hour prior to the scheduled time. Some hospitals are even moving it to an hour ahead of time, and then you have half an hour to an hour after that time. So if the medications are ordered to be given at 9 o'clock, you can start administering the meds at 8 o'clock and all the way up to 10 o'clock in some hospitals. Check the policies, though. And that's how you can give all your 9 o'clock meds to all 5 of your patients. But you need to think about your patients. Okay, who's my sickest patient? Who really should I be seeing first? And that's going to help prioritize your care, and who's going to get their medications first. Come up with your plan. You're going to actually go pull the medications. Make sure you're only pulling medications for 1 patient at a time. Then you're going to actually implement and go into the patient's room and administer the medications. And then remember, you're going to reevaluate. You're checking to see whether or not the medication is working like it's intended to work. And then you're also checking to see if they're having any adverse effects. We're going back on memory lane. Here we go, back to fundamentals again. So remember, when it comes to drug names, there are 3 different types of drug names. We have the chemical name, we have the generic name, and we have the trade name. The chemical name, remember, that's the exact description of the drug's composition. When it comes to the chemical name, I do have the example for acetaminophen there. You can see the chemical name is N-acetyl para-aminophenol. Could you imagine if we had the drug listed like that on the drug shelf at the pharmacy? Nobody would understand what in the world that is. So they came up with the generic name. It's a little bit easier to say. That one's still kind of hard. Acetaminophen. Well, in order to sell it to the patients, they came up with a name that sounds much better. So then you get the trade name. So of course, Tylenol. It sounds much better. It's more catchy, and more people can buy it. The generic name, it really is the official name, and this is going to be given by the manufacturer who first develops the drug before the drug is approved by the FDA. We're going to talk a little bit more about that. Typically, drugs, when they're first approved by the FDA, they're going to be sold under the trade name. And then it takes a few years, and then other people finally get rights to manufacture the medication listed under the generic name. And generic drugs tend to be cheaper, especially those over the counter. And even prescription drugs, the generics, that's the biggest thing. They tend to be cheaper. Here's another example of trade name, generic name, and chemical name. So Tagamet is the trade name, cimetidine is the generic name, and the chemical name is N-cyano and methyl. So remember, the trade name is going to be the name in which the manufacturer markets the drug. So like I said, it's a catchier name, and people tend to remember it a little bit better. When you're looking at drug labels, you need to know where on the label is the trade name and where is the generic name. So here's an example. Lasix is going to be your trade name, and then furosemide is the generic name. So I have those pointed out for you. Make sure you understand the difference between trade name and generic name. I mentioned that the medications need to be approved by the FDA, so we do have federal legislation that is helping to protect the public. And what they're protecting them from is drugs that are impure, toxic drugs, ineffective drugs, or drugs that are not tested prior to being up for public sale. So when it comes to the process of manufacturing drugs, it is very, very costly, and we're going to talk a little bit more about this. According to one of the textbooks, it states that the cost to bring a new drug to market can exceed $1 billion. That's quite a bit of money just to make one drug. And then it takes an average of 6 to 12 years to get the FDA approval for these new drugs. So this whole time, they're going to be going through development and testing. It takes years in order to get the drug just in that process of manufacturing them, and many, many years till we actually have them for sale. This chart talks about the stages of approval to get approval from the FDA. So first, the manufacturers are going to be doing preclinical investigation, and then they'll go through 4 more phases. So phase 1, you can see this is testing the drug, and a lot of times they're going to have people sign up for this phase, and they're going to get usually about 20 to 80 participants, and they're going to start administering the drugs to these patients. And what they're doing is studying to see the safety of the medication and whether or not it's treating for what they have made it to treat. Typically, when the manufacturers are making one drug, they get 70% success rate making it through phase 1. So then they move to phase 2, and now again they're going to be testing it some more, so they need more people to participate. So in this stage they get about 100 to 300 participants. This can take up to 2 years, and this is studying the efficacy of the drug. 33% of the drugs make it past this phase. Then they move to phase 3, so we need more people to participate, so 1,000 to 3,000 participants. Again, this is years of process, 1 to 4 years going through phase 3. This is, again, studying the safety, efficacy, and dosing to make sure that they're giving it adequately to treat whatever it's intending to treat. So 25 to 30% success rate make it through phase 3. If they make it to phase 4, we still need more participants. We need to test this some more. So thousands are going to participate, and it can take another at least year. So this is studying the long-term effectiveness of the drug. It's also studying the cost effectiveness of the drug. So 70 to 90% do make it past phase 4, and then the drug gets to the market so they can sell it. Like I said, very costly and timely process. During the preclinical investigation, this is when they're doing a lot of laboratory research, they're mixing the chemicals, then they're going to do some studies on humans, but a lot of times they're going to do studies on cells, so think back to your microbiology. Then sometimes they're going to perform some studies and do some tests on animals, and they're going to look at the drug's effectiveness. They're going to look at different doses, and they're also going to be looking for adverse effects. So just that preclinical investigation can take up to 5 years. So this might put it into perspective a little bit. For every 5,000 agents that are submitted for preclinical testing, only 5 will make it for clinical review. So a lot of different agents are in that lab, and they're really trying to find drugs that are going to work, but only 5 make it for that clinical review. During phase 4, this is when they do post-marketing surveillance. So the new drug is now released, people are using this drug, but we're not just going to turn a blind eye and no longer look at this drug anymore. The FDA is still going to be surveying it. They're looking for harmful drug effects, and of course they're looking at the larger population, and then again over a longer period of time. So I have an example listed there, a drug called Nupro. It was approved for treatment of Parkinson's disease, and they ended up having to remove it during phase 4 because it was in a form of a patch, and that patch formulation ended up delivering erratic dosages. So, some patients were getting a very high dose, others not getting enough of a dose, so it wasn't working effectively. So the FDA left it on the market for 10 months, and then they removed it. So no longer was that drug company able to sell their product. When it comes to clinical trials for these new drugs, many drugs are not approved by the FDA for pediatric patients. We don't have a whole lot of research that's being done on pediatric patients. It really has been more recent that they are allowing more children to be included in clinical trials, and even not too long ago, they wouldn't even allow women to be included in clinical trials. So we are seeing a little bit more of that. A problem with this, though, once the drug was on the market, the doctors would prescribe these medications for kids anyway, and we didn't have that research backing to know if the drugs work the same way in children, if the dose was correct. So it really made it difficult for doctors because, we have this treatment for this disease, but we don't have enough research to know whether it's safe for these children. Controlled Substance Act it does define different categories that which these controlled substances will be put into place. So we do have Schedule 1, 2, 3, 4, and 5. Schedule 1 is considered the drugs that have no acceptable medical use in the United States, and these drugs have high potential for abuse. Examples of Schedule 1 drugs would be heroin and LSD. Schedule 2 through 5 have acceptable use for medical reasonings, but they also do have a potential for abuse. So Schedule 2 has a higher potential for abuse as compared to 3, compared to 4, compared to 5. Schedule 5 then has the less potential for abuse when compared to Schedule 2. When it comes to drugs being manufactured and developed by these drug companies, they do get what's called the new drug patent. So whoever the original drug developer is, they will have exclusive rights to both the name and marketing the drug, selling the drug, for 17 years after that new drug application has been submitted to the FDA. So the amount of time spent in approval then is subtracted from 17 years. So for instance, if it takes 7 years for approval, then the company has 10 years of exclusive rights. So then after the total of 17 years, competing companies now can begin to sell generic versions of the particular drug. So if you're ever wondering why in the world does it take so long for the generic version to come out, well, now you know it is a timely process and there are rules and regulations. So let's talk about pros and cons of the drug approval process. So what do you see as the problems and or benefits of the U.S. drug approval process? I don't know if you realize, but other countries, sometimes they will approve drugs and our country is much slower to approve drugs. Maybe it's a newfound medication that they're really seeing good benefit from, but because of our country and the length of time, it could take a while for it to be approved in our country. And there has been cases then where patients will go outside our company in order to purchase the medications and have access to those medications. With the internet also, we are seeing people buying drugs over the internet. And, that could be good, it could be bad because, the FDA, they're really looking at patient safety and making sure they're protecting our public's best interests. So you can think about those different pros and cons. When you think about whether or not you should get the generic drug or whether you should just get the name brand of the drug, is it okay to go ahead and just get the generic brand? Well, many people will end up buying the generic form because it's more affordable. So you go over the counter, you see the different products, you see Tylenol, for instance. Tylenol could be 5 times as much as the generic version, acetaminophen. So, a lot of people end up going with the generic. Nowadays, we see insurance companies really forcing the generic drugs on the population. I know, for instance, my medication, one medication I take is Nexium, and I take that for my history of GERD. Well, I could always get the name brand of Nexium, but they just recently came out with a generic form. Well, my insurance company, as of January 1st, they no longer allowed me to get my prescription filled with the name brand only. So now I'm being forced to have the generic version. And I can tell you from my personal experience that the generic version does not work nearly as well as the name brand. Well, why is this? Well, we're going to talk a little bit more about this. Well, we're going to look a little bit more about the pros and cons of generic drugs. To let you know, generic drugs, they do have the same active ingredients as the the name brand drug. However, the generic drugs typically are going to have different binders and fillers. Well, what does this mean? Well, there's different chemicals added into that medication. And these binders and fillers, they can alter the drug's absorption rate. So the trade name drug, that drug may be absorbed a whole lot faster. And now we have the generic drug, it's going to take longer to work because it's absorbing at a longer rate. So it may take longer time for those generic drugs to actually take effect. So trade name drug, it might take an hour to start working. Generic, it may take 2 hours to start working, all because of these binders and fillers. So the generic drugs, they still have to be approved by the FDA. They're still going to get a rating from the FDA, but the FDA considers it the same drug if the serum concentration, so this is if they test the patient's blood and test that serum for that drug, if the serum concentration falls within 80% and 125% of the brand drug, it is considered to be equivalent to that brand drug. So think about that. 80% to 125%, we could see a difference of that much, and it's still considered the same drug. This really makes me wonder, is it really the same drug? So now you may think twice about buying that generic form. So typically there really should be no problem between brand name products and generic. But if you think about these few substance differences, a concern technically could exist. Let's talk a little bit about over-the-counter medications. In our country, Americans spend about $20 billion every year on over-the-counter medications. So more than 60 to 95% of all illnesses are initially treated with over-the-counter products. What does this mean? Well, a lot of times patients, they're going to have some sort of symptom. A lot of times they go to the store, to their pharmacy, and they look for an over-the-counter product that might help with their symptoms. So initially they're self-treating. I want you to look in your cabinet at home, look in your medicine cabinet, look at all the different over-the-counter medications you have. So on average, a home medicine cabinet contains 24 over-the-counter preparations. Right now, the FDA, they are in the process of making more drugs available over the counter. It used to be like medications for GERD. I already mentioned about Nexium. Well, now I could go to the pharmacy and I could purchase Nexium over the counter. So what's the difference between over the counter and my prescription? Well, my prescription, it is a little bit cheaper to purchase it that way because my insurance will help to cover the cost. The difference also is the dosage. The dosage for the over-the-counter is actually less than my prescription dosage. So you got to look at those different things. And if I would purchase and take 2 of those pills, then I would be overdosing with my dosage. So it really depends on the patient and their signs and symptoms, whether or not that over-the-counter product is going to be effective for them. We also see other medicines for GERD that it hasn't been that long ago you needed prescription for these drugs, such as Prilosec, Prevacid. A lot of those drugs, they're now over the counter. So the FDA is also working to standardize labels and provide better information for these over-the-counter drugs so the consumer, or whoever's buying it, excuse me, has a better understanding as far as what are these drugs and what are they intended for. And then they can also look for side effects, possible adverse effects that they may be having. So it's really educating the public a little bit better. If you have time, I encourage you to go to the pharmacy and just look at all the different over-the-counter products that are available. Look at the labels, see what the reason is for all these different medications. And you can go into one aisle, and you may see medications for the cold, for flu. You may see medications for pain, for fever. You have medications for the stomach. You have medications for the bowels. There's so many different over-the-counter drugs. So I encourage you to look at all these different over-the-counter drugs to see what they are used for to treat. And then think about it. Are over-the-counter drugs safe? You have patients that you're going to be dealing with. You should ask them about their over-the-counter use. Let's say you have a patient that you're now going to give Percocet to, and maybe you're sending them home on this prescription. Remember, Percocet has Tylenol, and you really need to educate them. They can't be taking Tylenol over the counter at the same time as taking the Percocet. So we really need to make sure we're asking those questions, assessing to see what are the normal over-the-counter products that they use. So what are some potential problems with the use of the over-the-counter drugs? Well, if the people are not reading the labels carefully, they may end up underdosing themselves, they may end up overdosing themselves. And if they're using more than one product for the same condition, we may see some drugs interacting with each other. And it really does come down to good education for these patients and making sure that they're not using over-the-counter products at the same time we're giving them a prescription for the same thing. Where do you think your patients get the sources of drug information? Well, a lot of times they ask a friend. Think about yourself. Do you ask a friend? Maybe you call up your mom or your dad and ask them. Maybe you have an aunt or uncle that you call up. Some people will talk to the clinicians, they'll talk to the pharmacists, and the pharmacists are available at the pharmacies. If you have a question about over-the-counter product, you could take it up and you could ask the pharmacist. A lot of people, though, they don't take the time to ask questions of these people that do have the knowledge and the experience with the drugs. With clinicians, a lot of times people don't have access to talking to a clinician, so they usually don't call the doctor and set up an appointment because that may be an additional cost to them. Another place for information would be the poison control centers. We have pharmaceutical sales representatives. They're the ones coming around, educating the doctor's offices as far as the different drugs that are out, the new drugs that are out. And right now, there's so many new drugs that are coming out every year. Another big source where our patients are getting their information is the internet. And remember, not all sites on the internet are reputable websites. So if the patients are going to the internet, they need to make sure they're going to a reputable site, such as WebMD. They do have a lot of good information, and everybody has access to that website. So we do need to educate our patients. Make sure if they are using the internet for their information that they are getting adequate information and accurate information. Nowadays, our patients may actually try to be using more natural remedies such as herbal supplements, and it really is alternative therapies, and it's very expensive industry, multi-billion-dollar industry. A lot of people are using these, and the sales of these dietary supplements does exceed $27 billion every year. So why in the world are we seeing such a popularity of herbal supplements? Well, people tend to think it is more natural than using all these different chemicals. So as a healthcare provider, then, what may be some of the concerns to healthcare providers? Well, if they are using these herbal remedies, they may interact with the drugs that are being prescribed by the healthcare providers. So we really do need to ask the patients, are you taking any herbal supplements? Make sure we're assessing that. And that is what the nurse's role is. And then, of course, you have to make sure you communicate this to the healthcare provider so we can look to see if there are any interactions with these natural supplements compared to the prescriptions that the doctor is giving. I wanted to talk a little bit about substance abuse, and you should be familiar with these different definitions. So drug abuse, this is using a drug in a fashion that is inconsistent with the medical or social norms. So they are not taking the medications as prescribed, or they may be using different routes according to what is not prescribed. So I have seen patients that they are prescribed Percocet and they end up, instead of using it as a PO medication, they will melt it down, they'll mix it with water, and they could be injecting it, they could be smoking it. So this would be considered abusing the drugs. And then, of course, drug addiction is a disease process, and it is characterized by continued use of specific psychoactive substances despite the physical aspect. So the patients become addicted to these drugs, and now they physically need to have these drugs, or they go through withdrawal symptoms. And we're going to talk about that in a minute. Some other definitions that you should be aware of is tolerance, psychological dependence, physical dependence, cross-dependence, and withdrawal symptoms. Tolerance is really where the patients, they take the medication so much that their body now doesn't respond so well to the medication, and it requires an increased dose or frequency of doses in order to get the same desired effect. Psychological dependence is when they mentally need to have that medication. And then physical is if they don't have that medication, then they go through side effects of not having that medication in their system. So then they end up going through withdrawal syndrome. And of course, withdrawal syndrome can be similar to the flu. They could end up having diarrhea, nausea, vomiting, body aches, muscle aches, and fatigue, a lot of different signs and symptoms. And of course, that would be considered withdrawal. So if they don't get their next dose, then they end up withdrawing from the drug.